Greetings, everyone. Greetings from New York City, where thankfully we are no longer the epicenter of the COVID-19 pandemic. In fact, after 22,000 COVID-related deaths in the city, we're now coming towards the end of day one of phase one of the reopening of the New York City economy, which has been effectively shut down for about 3 months. So this is the first phase of 4 phases that will culminate in the full reopening of the city's economy, hopefully bringing us back to normal or some form of new normal. And this, of course, assumes, perhaps bravely, that there will be no resurgence and no second wave of infections here. So our webinar today is about one dimension of the pandemic crisis, that is food security, a very complicated dimension that is linked to many other aspects of life and the economy. So food security, the title of the webinar today is also Food Security and Nutrition, taking a broader view of food security. One thing that we've all learned from COVID-19 over the past few months is that it's not simply a health issue. It's affected the functioning of all social and economic sectors, and almost all of them affected for the worse. Those sectors have included education, housing, transport, hospitality, entertainment, tourism, and of course, the food system. So more than half of the world's population and 80% of Americans live in cities. And that means for people in cities to achieve food security, by and large, they depend on income from their employment, from remittances, and from social protection systems. What may surprise many of you is that only 40% of American households have enough liquid savings to live on for 3 months. So you can imagine that so many are nearing the end of those 3 months of liquid savings, and indeed many have really consumed the last of their savings. You may also be surprised to know that in the United States, 30 million children depend on school meals. 20 million of those get their school meals for free. So imagine what happens when the schools close. What happens when the schools close and their parents lose their jobs? What happens when the schools close, their parents lose their jobs, one of them needs to be hospitalized without health insurance, and on top of that, a hurricane or a cyclone hits the country, which has actually just been taking place in the southern part of the United States? Well, what happens is, and what we've seen so far here, is that the country's food banks become besieged by the hungry and the fearful. Most likely that 60% who didn't have the liquid savings. Very uncertain about the way forward. So millions of people have actually been flooding a food assistance system that was never designed for a crisis on the scale we've experienced here. Food and volunteer workers are both in short supply at these food banks. And in early April, the National Guard was mobilized in one state, in Louisiana, to ensure smooth operations of food distribution. There was tension, there was anxiety. Now, observing what was going on here in America brought back a lot of memories for me from Africa. And 15 years ago, I visited Malawi during its first drought in more than a decade. This was a dry spell during the growing season that reduced the national maize yield to less than 1 ton per hectare, which is 30% less than the long-term average. So by the end of 2005, 5 million Malawians, 38% of the population, were at risk of acute hunger and possible starvation. Now, in 2005, we didn't have COVID, but we have HIV. It was a threat to health and well-being in Malawi and across much of Southern Africa. Food insecurity and the AIDS pandemic were very closely linked. So there's a common thread in these two cases, 15 years apart in vastly different socioeconomic settings. That is that vulnerable people have lost their ability to access food. They've lost their food security. They've lost, and I quote, access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. And that's the definition of food security coming out of the World Food Summit in 1996. So what's going on in Malawi now and elsewhere in Africa? I'll just say a few words about that, although having been sheltering in place here in New York for the past 3 months, I'm not having very direct personal experience, but reports are emerging. On the COVID preparedness side, the health systems of most countries there are ill prepared for the impacts of the pandemic. Malawi, for example, has 16 working ventilators. That's one ventilator per 1 million of the population. And there are huge concerns as well regarding hospital beds, PPE, testing, isolation, contact tracing, and physical distancing. With respect to food security and nutrition, the key point to note is, despite the fact that we've seen progress in sub-Saharan Africa over the past 15 years, it still has the highest prevalence of hunger and malnutrition in the world as a region. They had that before COVID-19 came along. So the pandemic is exacerbating the problem, made worse further by the locust outbreaks that have been occurring in some parts of the continent. And in other parts of the world, and as in other parts of the world, both supply and demand are adversely affected by COVID-19. Most African countries depend heavily on food imports, and the region is expected to import between 40 and 50 million tons of cereal each year. So those supply chains will be affected. As Jeffrey Sachs noted in his talk in this webinar series last week, Africa is more likely to be experiencing a delayed impact rather than an escape from COVID-19 and its effects. So with that brief overview of really two areas that I'm perhaps a little bit more familiar with now, and that's the United States and Africa, I wanted to stop here and now introduce our three expert panelists who are joining us from different parts of the world. Let me introduce, first of all, Dr. David Dawe, Senior Economist at the FAO Regional Office for Asia and the Pacific. David holds a PhD in economics from Harvard University and specializes in agricultural and food policy analysis. He spent most of his career living and working in Southeast Asia, including several years with the International Rice Research Institute, where we had the good fortune to work together. Following David, we will hear from Dr. Marie Ruel. Marie is Director of IFPRI's Poverty, Health and Nutrition Division. She holds a PhD in International Nutrition from Cornell University. She's worked across many aspects of food security and nutrition. Indeed, I believe she was IFPRI's first nutritionist. Her current research includes multi-sectoral nutrition-sensitive programs aimed at reducing maternal and child malnutrition. And in 2019, Marie was awarded the Kellogg Prize for Lifetime Achievement in International Nutrition. And our third speaker will be Professor Madhura Swaminathan. Madhura is professor at the Economics Analysis Unit, Indian Statistical Institute in Bangalore. She has a doctorate in economics from the University of Oxford and works on food security, agriculture, and rural development. Madhura is also currently the chairperson of the MS Swaminathan Research Foundation. So these are our three exceptionally well qualified speakers on the panel, and they will share their diverse perspectives on this issue of food security and nutrition in times of COVID, including what lessons we may learn for going forward in terms of improving resilience to pandemics and other shocks. Just remind everybody, if you have questions, we'll reserve that until the three speakers have completed their talk, and we will please use the Q&A function on this webinar. So first of all, David, over to you.
Okay. Thank you very much, Glenn, for that introduction. Thank you also to Monash University for putting on this excellent series of webinars and for inviting FAO to participate in this. So I'm going to talk about the coronavirus and its impact on food systems in Asia and the Pacific. And the most important factor, variable that drives food systems and drives food security is income. There are many others as well, but income is probably the most important. And the numbers in this regard are not pretty. Before the coronavirus hit, the International Monetary Fund was predicting a 3% expansion of the global economy in 2020, but their most recent projections now forecast a 3% contraction, a swing of 6 percentage points, which is pretty big. All the major regions of the world are expected to contract in terms of their GDP this year, with one exception, emerging and developing Asia, where there's forecast for a 1% expansion, but this is much less than the 5.5% expansion that we saw in 2019. Now, these numbers are projections, but we've already seen some first quarter GDP estimates from countries in the region that are showing negative growth. So we've seen contractions in China, Japan, the Philippines, Singapore, and Thailand. India, Indonesia, Malaysia still have their economies expanded year on year in the first quarter, but by much less than would be expected in normal times. And these numbers are really, really important because, as Glenn said, income is a very important part of how people access food. And so when you have a big income shock like this, access to food will be affected. Food security will be affected negatively. Now, income's not the only determinant of access to food. Food prices are also quite important. In that regard, the news is quite a bit better. The FAO Food Price Index has been declining over the last few months. The FAO Food Price Index is a trade-weighted index of international market food prices, not domestic markets, international market food prices for different categories of food. And you can see up here on this graph that over the last few months, prices of vegetable oils, meat, sugar, dairy have all been declining. Cereals has declined a little bit, but basically been pretty stable.
David, you need to share the screen, please.
Oh, gosh. Sorry, I thought I did that. Okay. Geez. Okay, so I'm really sorry about that. Let me get that up here. There, okay. Thanks for that, Glenn. I'm sorry about that. Can you see it now?
It's good. Yep.
Okay. So far this year, the FAO's food price index has been declining. And I think there's a good chance that it will stay that way. for the rest of the year, or at least for the next few months. Early forecasts point to record maize and rice output and a recovery in soybean production. Inventories of rice, wheat, and maize are also set to remain high or increase, or both. So in that sense, the world food economy is in pretty good shape. Now, that doesn't mean that nothing can go wrong. One thing that can go wrong is export restrictions on international trade, panic buying, and the like. We saw some things like that in the 2007-2008 food crisis. And we had the beginnings of a little bit of that this year. In late March, Vietnam announced a ban on new export registrations for rice exports. And if you look, that happened on March 24th, and that corresponds to the little trough in prices that you see on your screen. Over the next 2 weeks after those restrictions were put in place, prices went up by $100 a ton, about 20%. The axis is a little distorted. I did that on purpose just to show a little bit more clearly the impacts of, the day-to-day impacts of what happened when trade policies were changed. So prices increased for 2 weeks. After that point, Vietnam changed course and agreed to an export quota of 400,000 tons per month, which is a pretty decent amount. Prices promptly fell. They then leveled off for a little while, and then when Vietnam announced the complete abandonment of all restrictions, prices plunged back to their original level during May. This was not just a story of Vietnam. Myanmar and Cambodia also announced export restrictions during that time. Those are largely now gone. There was also, it's also of note, there was little example of panic on the part of food importers. Indonesia and Philippines are the two big rice importers in this part of the world. But they were both entering harvests at the time. So Indonesia was entering its main harvest. The Philippines was entering its dry season harvest, which is a pretty big crop. And so they did not engage in panic buying. And it seems like right now the world rice market has dodged this bullet, at least for now. I also, before leaving this, I just wanted to give you a little bit of a longer term perspective. Though I was showing you their daily prices over the last few months, these are monthly prices over the last 15 years. And you see right at the very right, there is definitely a blip, but it is not very big. Kind of historically speaking, certainly nothing remotely close to what we saw in 2008, which is easily visible from the graph. Now, world food markets are really, really important for food security, but domestic food systems are also very, very important and much more important, in fact. For most large Asian countries, more than 85% of calories are produced domestically. They're not imported. And so obviously domestic food systems are very, very important. Now, we've heard many reports of anecdotes of intermittent malfunctioning of food supply chains. And these reports are true. We hear reports of dairy products being dumped, of vegetables and fruits rotting, of farmers not being able to get fertilizer, farmers not being able to get labor to harvest or plant the crops. All of these things are going on. But on balance, it seems like the malfunctioning of food supply chains that we read about has been more intermittent than persistent. And I think there's a couple of reasons for that. One is that countries have declared food and agriculture as essential services. Anybody who's lived in Asia for even a little while knows the importance of food in society and culture, as well as in just eating. And so it's no surprise that governments acted quickly to declare these services exempt from lockdowns. Now, of course, there were hiccups and problems, but I think the important thing is that governments everywhere in the region realized how important food and agriculture is. Another important feature to note is that I think there's been pretty good collaboration between public and private sectors. And this is really important because most of the food is produced and marketed by private firms. It's not the role of government so much. And for example, Thailand has set up war rooms on a commodity by commodity basis. So for rice, for livestock, for fruits and vegetables, that provide a mechanism where the public and private sectors can meet frequently. And when there are problems, when there are disruptions in food supply chains, which are happening, they can be quickly resolved and solved. And I think, let me show some evidence here about why I think the food supply malfunctions have been more intermittent than anything else. And I'd like to show some data here on domestic food prices as well as the general CPI. These data are the cumulative increase over the last 4 months. And you see here that food price increases, which are in orange, have been relatively subdued. There hasn't been more than a 3% increase over the last 4 months in any of these 11 countries in the region. And so I think this is a suggestive sign. It's not definitive, but it suggests that the food supply malfunctions have been intermittent. The reason it's not definitive is that prices are the outcome of supply and demand. And we have contractions in food demand and possible curtailments of food supply. Now, it's possible that you could have massive contractions in food demand and massive reductions in food supply at the same time, and they just exactly, happen to balance in all these 11 countries. But I think that would be quite a coincidence that if that happened. So I think the evidence is suggestive that food supply chains, all in all, are doing pretty well because of the policy attention that's been given to them. It's certainly not a given that this would have happened. One thing that if you look at those data, food price increases are slightly greater in Eastern and Southeastern Asia than in Southern Asia. I think this is consistent with Southern Asia being poorer, and when you're poor, your income elasticity of demand for food is greater by necessity. And so we may see more of this contraction of food demand having more of an impact and keeping a lid on food prices in Southern Asia than in Eastern and Southeastern Asia. Interestingly, the data I looked at, that for the 5 countries where I could find, those 5 of the 11 countries where I could find disaggregated data by different types of foods, so oils and fats, rice and cereals and bread, fruits, vegetables, seafood, things like that. There was no obvious price differences in price changes between perishables and non-perishables. We might have expected to see bigger price increases at the consumer level for perishable foods, but generally, there are instances of that, but generally speaking, that doesn't seem to be the case. So now, what are the impacts on food security and nutrition of all of this? Well, first, job losses and slowdown of economic growth will make access to food more difficult for many people. And Professor Assad of Monash, who was the host for this session today, he shared an interesting paper with us that did some surveys of work in Bangladesh, and it showed that many people have suffered severe income losses. And so this is almost certainly going to lead to reduced food security and nutrition. And in fact, he showed that a lot of people were severely food insecure or moderately food insecure, according to FAO's food experience scale, food insecurity experience scale. Another important point that I think is worth noting is that compared to the 2008 crisis, agriculture is likely to play a reduced role in absorbing the jobless than it has in the past. One important reason for this is all the economic growth we've seen in Asia over the last 20 years means agriculture is now a smaller share of the economy. Agriculture is also more mechanized now, And once you start to mechanize things, it's very difficult to go back to labor-intensive techniques of food production. Finally, another factor is that urban workers now are an extra generation removed from agriculture than they were, say, in 1998, when we had the Asian financial crisis. And they may not have the necessary skills for work in agriculture anymore, or the desire to engage in that type of work. Fortunately, food prices seem stable so far. That's the good news, but the reduced income, and I think these are really big income shocks we're talking about, will make nutritious food less affordable, especially for the poor. Now, what are just to end my presentation here, what are some of the policy responses that need to be in place? Well, first of all, and most important, we need to control the spread of the virus and implement physical distancing in food supply chains. Without that, we're not going to be able to get very far. It's also going to be very important to expand social protection, especially for the poor and the vulnerable. The research on Bangladesh that Professor Assad was doing that I mentioned a few minutes ago, that also had an interesting statistic in there. It seemed of the people that were severely food insecure, according to their own experience, only about 15% of them reported receiving assistance from the government. That means 85% did not. Now, that doesn't mean they're not getting assistance from family and friends and things like that, but I think it will be important to expand social protection as much as possible. This will obviously be difficult in many poor countries. We can't expect to get 100% coverage, but we need to expand it as much as we can and do the best that can be done. We'll need more private-public cooperation to solve supply chain disruptions as they arise. I think a pretty good job is being done in this regard so far. We need to keep international trade open. I think we've been doing a pretty good job on that as well. ASEAN has made some statements, as well as Australia and New Zealand and many other countries in the region, that Singapore, that are determined to keep international food trade open. And finally, I think to deal with both this pandemic and with future pandemics, we'll need to build more flexible and resilient food systems. And I think I was reading an interview with Professor Larry Summers a couple of days ago, and he was talking about supply chains in general, not food, but he stressed the need that, maybe we're too, at times, obsessed with efficiency. Efficiency is obviously important, but we need to move from a system of being just in time to just in case. And I think this seemed like good advice for our food systems, so that we are flexible and we can minimize supply chain disruptions in the future. So with that, I'll stop for now. FAO thank you very much for your attention. For anyone who's interested, the web addresses there give some links to some FAO policy briefs on COVID-19. Thank you very much.
Thank you, David. Excellent. A great overview of what's going on in the region, and also your perspectives on the kinds of lessons we're learning and what can be done. So let me move on to the next speaker, Marie. Please go ahead.
Yes. Good evening, good morning, good afternoon, everyone. It's a real pleasure to be here, and I thank the organizers for giving me the opportunity to talk about the expected impacts of COVID-19 on nutrition. So before we start, I wanted to give a brief overview of where we were just a few months ago before the crisis in terms of our progress in improving malnutrition. So we have still 144 million stunted children. We have, and stunting refers to children being too short for their age and therefore having chronic malnutrition. 47 million are wasted, meaning that they have a much higher risk of mortality in early childhood than healthy children. And there's 38 million overweight globally. But what I wanted to point out is on the panel on the right is the nice trend that you see here in reducing stunting in the past 2 decades. So we've had a regular, very positive trends in reducing from about 200 million in 2000 to about 144 million in 2019. So we still have a lot to do, but with the current crisis, we're really worried about the risk of backsliding and losing our momentum and all of the efforts of getting where we are now. Another important malnutrition factor is the micronutrient malnutrition, which affects 2 billion people worldwide. And not just children, everyone at every age can be deficient in essential micronutrients like iron, zinc, vitamin A. Those are very widespread deficiencies. And the point at the bottom is the fact that, of course, Africa and Asia bear the greatest share of all forms of malnutrition, including underweight and overweight and stunting. So why does it matter? It matters because malnutrition in early childhood is associated with 45% of child death. So this is a very high percentage, and it's deaths usually due to infectious diseases. And of course, the long-term consequences that we have heard about on health of an individual at adulthood, on cognition, on schooling, on economic productivity. So basically, malnutrition affects human capital in all of its forms. So now what I will be discussing is why we think that we will have such a large impact on malnutrition because of the crisis, not just the COVID crisis, but the economic crisis and food system crisis, is because the crisis is affecting all of the systems that we rely on for improving nutrition. And I start here with the health system, of course, which is our main delivery system for nutrition interventions. There's food systems, of course, that provide food, so they provide nutrition, social protection systems, which are extremely important for poverty reduction and for improving food security. And then finally, water and sanitation, which is our main sector to protect and prevent infections. So I will cover briefly each of those sectors, but very briefly. So in terms of disruptions in health system, this has been talked about already. We have seen and we expect even more disruptions in health services as resources are reallocated to COVID. So staff and supplies are reallocated to COVID. So this results in significant drops in coverage of essential nutrition and health interventions, and all of the routine prevention and treatment of infections and severe acute malnutrition that the health sector does. So that means no antenatal care in certain countries right now, no access to health services for delivering children, no vitamin A supplementation, no immunization, etc. There's also stockouts of essential drugs and of micronutrient supplements, micronutrient fortified, ready-to-use therapeutic foods, all of those supplements and foods that are absolutely essential for maintaining the micronutrient status of mothers and young children, for example. And the ready-to-use therapeutic foods are a life-saving strategy for children who suffer from severe acute malnutrition. So those are in short supply because of local reductions in local production and a combination with international trade. There's also important drops in demand, which is not surprising. People are concerned about going to health services and getting infected. The lockdown and the restrictions on mobility were also preventing people from being able to go, or they may not have had transport to go. So we have a real crisis, obviously, a health crisis. And what this slide shows is some of the early impacts that we expect from the COVID-19 itself in terms of reductions in the coverage of these interventions. So I mentioned some of them. There's a series of essential nutrition and health interventions that are needed, especially for women during pregnancy and lactation and for children during the first 2 years of life. And so what we see here is a modeling that has been done using the LIST model that the Hopkins University has been using. And it shows that if the coverage of intervention is reduced by 40%, 45%, we expect an increase in maternal deaths of 56,700. And for children, we expect more than a million additional child deaths. So this is because those services save lives, but also because children who are likely to become more wasted because of the crisis are an important source of mortality. As I mentioned before, wasted children are 11 times more at risk of mortality in early childhood than children who are healthy. So we expect even greater impacts, and IFPRI is starting to work with the LIST model to model the combined effects of the economic crisis with the health crisis on wasting and on child mortality. And we are starting to see numbers that go in the 3 to 6 million. We don't have the exact numbers yet, but this is really a very big impact. Now, in terms of the economic crisis, this has been mentioned already. I will go fast on that, but I just want to say that we expect a lot of additional poor, a lot of poverty. Models from David Laborde and others at IFPRI predict 148 million additional poor. And on the right side, what you see is that they also expect some reductions, and this was mentioned before, reductions in the consumption of fruit and vegetables, and the red bars are fruit and vegetables, and then on the right side, they are meat, animal source food, meat and dairy. And so we can see that the expectation is that there will be a significant reduction in consumption of nutrient-rich foods, and an increase in consumption of staple foods. This is totally expected in economic crises because people try to protect their calories. They try to purchase the cheapest calories possible, and those are always staple foods or pulses, but the fruit and vegetable and animal source foods are expensive sources of calories, and so people go for calories first, and then they can add to their diet more nutritious foods. So we expect a reduction in consumption of nutrient-rich foods, as has been mentioned before. We had some results from phone surveys, and here I'm providing some results from the Bangladesh Institute for Governance and Development that confirms that indeed there's a 70% drop in income in Bangladesh in the survey that they conducted in the sample they had, which is larger in urban slums, not surprisingly, a 25% drop in food expenditure, a little higher in urban slums, again, 28%, and an increased use of coping strategies. Those include things like reducing consumption or modifying the consumption and buying cheaper calories, as I've mentioned before, but also things like reducing the number of meals to less than 3 per day, for example, which is a more dramatic measure that is likely to affect the whole family, including the vulnerable mothers and young children. In terms of the food supply chain disruptions, we have some, again, some phone surveys from Ethiopia that IFPRI conducted, and that document both issues related to changes in demand and in supply. To my great surprise, in Addis, they find that 50% of households reported avoiding dairy, meat, poultry, and 22% reported avoiding vegetables because of COVID. They believe that fresh food, and especially animal source foods, are a source of transmission of the virus. This is total misinformation, but it's now become knowledge or perceptions of people. And so there's willingly a reduction in consumption. And there's also evidence that our team has documented, for example, for the dairy value chain, for meat value chain, and for vegetable value chain, that there are real disruptions in those value chains due to a combination of reduction in demand and in supply, but definitely a great reduction in labor supply, shortages of inputs, low productivity, prices, issues, waste, and so that everything that you hear about in the media is actually confirmed with these phone surveys. So we do have concern about the deterioration of diet quality. This is one of the ways in which we think that the crisis will have most impact on nutrition, and it will have impacts on micronutrient deficiencies. Now, in terms of social protection systems, I'll go pretty fast here, just to mention that this is a response that is happening in many countries. 170 countries have planned, introduced, and adapted social protection programs, mostly cash and in-kind transfers. This is information from Ugo Gentilini at the World Bank, who is tracking the policy response in terms of social protection in around the world. We know also that it is unlikely that these programs will be able to meet the demand, given how incredibly large the demand is and will continue to be for a while. In terms of school feeding programs, there were 370 million children without school meals because of the school closures, and about 70 countries have implemented take-home school meals. That's a small proportion of countries. And they have either school meals or some cash transfers. But again, there are concerns about the quality of those meals that they have to produce and distribute in mass. And again, the issue of diversity of these meals and of micronutrient content is really a similar concern for the impacts on micronutrients. Finally, water, sanitation, and hygiene are really the first line of defense for COVID. We've never needed clean water as much as we do now, and available water for hand washing. So I'm just mentioning here this call to action to make wash available, water and sanitation and hygiene available for everyone, eliminating inequalities, leaving no one behind, and taking care of the most vulnerable. So this is a very important sector for us also, as I mentioned, because it is the source of all infections that kill children. So in conclusion, how to protect nutrition. We have here a set of very broad recommendations, but the reason why they're broad is because we are covering all of those systems that are very critical to improve nutrition or to support nutrition. So first of all, for the health system, of course, we have to find ways to prevent the collapse of basic routine maternal and child health services. In India, for example, there are some initiatives ongoing where health workers have received cell phones and they've started to resume some of their activities with their cell phone, what they can do with them, among others, doing some nutrition counseling, for example. We need to keep the food systems functioning. This is clear, it's been said over and over, and that includes the informal sector, which employs 80% of women. We need to innovate to keep them functioning. We can't function the same way as before. We need to support local or homestead, even food production where relevant and feasible to increase access to nutrient-rich foods. So here again, we're talking about fruit, vegetable, eggs, and chicken that are very easily produced even in urban areas and in close to home or very close to cities. We need to find innovative ways to stimulate demand for nutrient-rich foods. We really have to correct this misinformation that I was mentioning and motivate people to at least purchase some nutrient-rich foods for their family using mobile phone messaging or other similar approaches to provide some nutrition counseling. For social protection programs, of course, we would like them to scale up and to cover everyone, but We would also like them to improve diet quality, not just quantity. We see everywhere that what is distributed by the government is staple foods, and what is the probably the content of the meals that are distributed is a lot of starchy staples. So we need to also remember to try to improve diet quality. We need to invest in WASH. This is a no-brainer. And we need to address vulnerabilities and inequalities. And this is a time when all of the vulnerabilities and inequalities have been enhanced and have been exacerbated. And this is not a coincidence that we have the current protests against inequalities. So this is a very important issue for now and for the future as well. Thank you very much.
Thank you, Marie. Thank you for that. Multiple sectors, and I think that's a strong message coming out there. We've got to think beyond simply health impacts on nutrition, but the various ways which nutrition, stunting in particular, are affected by these different sectoral impacts of COVID. I think are really important. Makes it very, very complicated. One of the last points you made in relation to inequalities, and I believe, Madhura, you're going to talk about this topic. You'll include that in your presentation about, I think, mainly about India. So over to you, Madhura.
Thank you, and thanks to Monash University and CDES for inviting me to this panel. I think that our work has been laid by the previous two speakers, so it's going to be easier for me to talk about perhaps something which has not been discussed as much, which is income poverty, which of course is very important implications for food security in terms of being able to buy adequate and nutritious food. Now, we all know that poverty and insecurity have increased, but I would like to say that I think the IFPRI numbers mentioned are probably very low. A wider study from Helsinki has suggested that a 20% contraction in GDP will result in an additional 419 million poor people at the 1.9 US PPP dollars a day. In India, we have 276 million people in 2011, according to the World Bank. We don't have more recent figures. I would hazard a guess it has increased at least 50%. So I think we numbers, then we realize that this is something that we should keep in mind. Now, there is an overall increase in poverty. There is going to be globally, and I think particularly in South Asia, Sub-Saharan Africa, maybe Central America, countries which already had a pre-COVID burden of poverty and food insecurity. But I would like to spend a couple of minutes on the inequalities. The COVID pandemic has not affected everybody the same way. It has affected women more. It has affected the workers in the informal sector. It has affected minorities, be it racial minorities in the US, or be it the discriminated population in India. And I'd like to give a few examples of that. So 90%, just as background, 90% of India's workforce is in the informal sector. And I think it's very important that we recognize that inequalities in gender, caste, and class have already been exacerbated. We may get the numbers only after a few months of, or even a year. So just to go back to the point I started with, the wider study, which I mentioned at the beginning, said that there would be an additional 419 million poor with a 20% decline in global GDP. that assumed that that the distribution was unequal, remained the same. In other words, everybody's income went down by 20%. But what I'm arguing is that everybody's income hasn't gone down and will not go down by 20%. There's clear differentials within countries and globally across countries. And these are very important to recognize. And I hope that those who work with models will put this into their models as well. So we have had some phone surveys in India as well. And a recent one of about 4,000 workers across 12 states of India by the Azim Premji University in Bangalore. Just to give you one example from their big report, 66% of the workers they interviewed had lost jobs. But when you break it down by rural, urban, men, women, and social background, the picture comes out clearly. So if you take casual workers, and what we mean by casual workers is those who are contractual jobs, temporary jobs, who can be terminated at any time. In urban areas, 82% of women lost jobs as compared to 80% of men. And in rural areas, it was 71 for women as compared to 59 for men. There is another agency called, which collects a lot of data on prices, employment, and so on. And from Denti, with those for a year ago, the biggest decline in employment was for rural women. Then the next biggest was for all women. And the next biggest was for the rural scheduled castes. The scheduled castes, or who were called untouchables earlier, most oppressed, discriminated section of the Indian population. So I think this is the first point that I want to make, that while there has been an overall shock, overall decline in GDP across the world, the impact of that is differentiated, and inequalities have risen, and I think will probably exacerbate at least till the rest of the year. Now I want to turn to something else, which is that how to measure poverty. Now, one of the measures of poverty that I have always used, and I think not recognized enough, is what is called the food share, or the inverse food share. So what is the share of your monthly budget expenditure that you spend on food? And that gives you an indication of how poor you are. The poorer you are, this was mentioned, the income elasticity point was mentioned earlier, the poorer you are, the larger the share of your monthly budget on food. So this criterion, looking at the food share, has actually been at the heart of two very large food programs in the world. The US food stamp program. In 2008, after the crisis, I believe 1 in 6 Americans was on the food stamp. I'm sure it's more now. The US criterion is that if you spend more than 1/3 of your monthly income on food, you are eligible for a food stamp. You're food insecure. China, about 20 years ago, when it had a system of food rations, the food share that they used was 50%. You can understand this very easily. If half my monthly income goes on food and my monthly income collapses to 0, you can see the kinds of effects it's going to have on food and nutrition, as Mary and others have talked about. So let me give you a number for India. This is about a decade old, but we don't have more recent numbers. This is households ranked by decile of monthly expenditure in rural and urban areas, and this is their food share. The lowest decile are spending 66 or 63% rural urban on food, and it continues like that, 60, 62. So what if we take the US criterion? If we take the US criterion, 100% of rural households and 90% of urban, maybe that's too much, take the Chinese criterion. India always compares itself with China for some reason. If you take the China cutoff of 50%, then 90% of rural households, that means everybody in the lowest 9 deciles is food insecure, and it's about 50% of urban Indians. Now, why I've spent a little time on this is because this, I think, gives you a different way of looking at who are the vulnerable and food insecure right now. And what I'm going to argue is that this implies universal programs. So what are the policy options now? And I think it's very important to start with the pre-COVID consensus and quotes, if you like. And the pre-COVID consensus that the World Bank and many other organizations were, and even many governments of many countries, I won't just blame external agencies, was what was called CCTs, which all students of economics must be very familiar with. What are CCTs? Conditional cash, and I like to add the word targeted transfers. And I think what I'm arguing today, and if anything, the takeaway of my talk is just this one slide, if you like, is that now in this crisis, we need universal or near universal. We need unconditional, and we need cash and kind, not just cash transfers. And I think this is very important. If anything, this is the one takeaway message. We've got to stop talking about conditional transfers, need to be thrown out of the policy box. Let me skip this slide on the US and go to India. So when we come to India, what do we see? The actual package that has been offered so far, the relief package, has been really measly and pathetic. And if we look at let me start with the cash transfer component of it, and then I'll come to the kind transfer. The cash transfer has been a one-time transfer, not a monthly transfer. $10 for poor women, and then a little bit more for few other categories. So it's very small and it's not universal. And many of us, economists, activists in India have been arguing that what we need, given the Indian income standards, is $100 a month. At least, I mean, it should have started in March, April. It hasn't, but at least going forward for the next 6 months, we need $100 a month for all rural households. As I said, the point here is that if you want to include 90 and exclude 10%, let's not waste our energy and efficiency on those 10%. You can claw it back through higher taxes or something. Let's go for universal transfers. For the rural areas, that's universal, and for the urban, it's about 50% of the population. Let me come now to the kind transfers. Although, again, there has been a strong move to dismantle our system of in-kind transfers, what is like a system of rationing started by the British, but which has been continuing. We are in fact lucky today that that network of ration shops, fair price shops exist. We have a network, we have a system through which we can provide kinds, transfers. And to comment on the point that Mary was making, right in the beginning, from early March, many of us have argued that it's not just the regular cereals that need to be given in adequate quantity, double the normal quantity, but we need to add pulses, oil, salt, soap. We need to make that a diverse food basket. And I think that is feasible. It has been announced in some states, and I want to just come to an example on that. I'm going to skip a few slides here and go to the example of Kerala. Because what I'm saying, universal cash transfer, a much more nutritious in-kind transfer, is this feasible? And the answer is yes, because we see that it's been done in one state of India, and that is Kerala. Now, some of you might have heard about Kerala and the writing of Amartya Sen and so many others. Currently, the last 4 years, Kerala has been under a communist government. And I think what is needed is the political commitment to make such transfers. And Kerala, right in the beginning, announced free distribution of the cereals, mainly rice, which is what is normally eaten in South India, and a multi-commodity grocery kit. And I have this infographic, which is from a newspaper, which shows you the 17 items that are in the grocery kit that has been distributed to almost 9 million households. That is almost the entire population, excluding, as I said, a few better off households in the urban areas, 9 million households in the state. And this has a combination of things, including something that many of us are demanding, which is soap. It's all right to ask for hand washing, but people have to be able to afford the soap. So let me, I can give, for those who are interested, I can share these slides and go into the details of the cash transfers and the kind transfers. But I think the point is made that you need a combination of kind and cash transfers. You need more diverse diets, and this has to be universal and unconditional. To close, I just would like to go back to World War II, which is being talked about a lot now, and the lessons of rationing from the United Kingdom, England, and Wales. The period of war when men were dying every day in the battlefield was actually a period with the best improvement in life expectancy and reduction in male mortality in England and Wales. And this is because of equal distribution. Everybody had a ration and it was equal. And I'm not going to go into what the ration comprised of, but I think that's something that we need to keep in mind today. This is my last slide. We must recognize from the perspective, we must use this crisis to change policy and food insecurity, and ensure a universal safety net with a combination of transfers in kind and cash. There will of course be variations across countries, but I think the last point is very important. Countries have to raise resources from within. Countries like India can, the kind of wealth that we have. People are talking about Pigovi and other forms of tax, raise a safety net.
Thank you, Madhura. Great. We've got around 20 plus minutes, 23 minutes for Q&A. I'm looking for some questions, and I think a few more might come in. But let me ask, sort of to connect a little bit the last two presentations, and I was really impressed by that package of what appeared to be a very nutritious set of products. I think with a lot of micronutrients in there, if every household would be receiving that in Kerala. But what Marie, one of your recommendations was, of course, and it's been recommended for a long time, that people should consume more nutrient-dense foods. And in fact, you're seeing the reverse happening with COVID and people's incomes going down. Can you just give us some sense of beyond food transfer programs of some kind, what can be done to encourage low-income people to consume nutrient-dense foods? I mean, it's obvious here, even in New York City, that when people are down on budget, they'll buy empty calories to fill themselves up, right? So what have you seen? What would you recommend in terms of policies to bring people to be consuming more of the nutrient-dense foods, and with all the benefits that come from that?
Yes, I thought I had to unmute. Yeah, so it is a very important question, how to make those nutritious food more available and accessible. And that's why I was mentioning the homegrown, the homestead food production, or the production close to home, as opposed to trying to continue to work with these long value chains. The other important thing that people have to know is that in low and middle income countries where people really don't consume a lot of animal source foods, we're not talking about consuming large amounts. I think it's really important for people to recognize that small amounts are so much better than nothing. And mothers and young children are the ones that should get the rations, if there are any rations of those, because they are vulnerable, they're nutritionally vulnerable, and the children have very high requirements for growth and mothers during pregnancy and all that. So from the point of view of education, it is important to recognize, as I said, that it's not about large quantities. And you raise a point about people buying packaged foods and in the US, ultra processed and really very unhealthy foods. I haven't mentioned that, but we do expect that the crisis will exacerbate obesity as well, because people, with the lockdown, a lot of people were not doing any exercise, and on top of it, the chief calories are always the ultra processed foods in places where they're available. They're available a lot in low and middle income countries now as well. They are cheap and equally non-nutritious and high in calories. So that's another risk, especially for urban areas in low and middle income countries.
Thank you. Asad, you can always jump in.
Yeah, I have some questions that came to me. So there is a question on income support. How long we, at least in developing country, the government should continue to give income support, or is there any role for subsidized food versus cash transfer?
I think that question may have been addressed to me. Is that?
I think so. But I think you answered it still. Please go ahead.
Should I answer? Yeah, okay. So I think, I mean, we have to see how the situation develops. In India, the graph, we haven't flattened the curve. The graph is still rising. So I think the time period for cash transfers depends on how the economy recovers and how quickly jobs come back. So as of now, we may say 6 months, and we hope jobs come back by then, but if they don't, we'd have to extend it. I want to add one point here linked to the previous question. What has happened, at least in India, the price of cereals and fruit and vegetables haven't gone up very much, but the price of meat, fish, poultry, eggs, and milk has increased. And that's not surprising, because when supply chains break for these commodities and you don't have enough cold storage, refrigeration, and so on, there's really been a collapse of production. So I think this is something of concern from the nutritional point of view, and that will need to be addressed.
Could I follow up that? I mean, the idea that the diets are changing, and these are being addressed through various kinds of social protection programs. It seems to me that that's kind of like it's keeping people alive. Well, you talked about these fundamental inequalities that exist within the households and within villages and within cities. How do we actually address those structural differences? So we're doing more than keeping people alive, but we're actually closing those inequality gaps and creating some kind of a pathway to better lives for people who are currently in the below the poverty line. What's beyond cash transfer and in-kind transfer for food and so on, but what's really missing there in terms of government investments to address the inequalities?
Glenn, can I?
Sure. Did you want to answer, or should we ask David?
I'll come in after David. Yeah, I'll come in.
David.
Okay, yeah, I think one thing that's important to realize that even keeping people alive and doing the minimum makes some contribution in this current context, because of the fact that even temporary shocks can have permanent effects that affects, the cognitive development of young children, as Marie mentioned, lifetime earning capacity and wages. I mean, it's really scary how, being born in one particular year or something like that can have a big difference on your adult, the outcomes of your adult life. So I think, even just keeping people alive is an important step, but I also agree with you that it's not enough. Then I think, ultimately we need to find ways to get people to, remove those income inequalities, better education, better skills training. There's all kinds of things that can be done. This is a long run problem that we've had for a long time. It's not new to COVID. And I think we just have to address it with those longer term structural kinds of reforms.
Yeah, I guess what COVID is doing is reminding us of what those are, because as Madhura and others have suggested, it's exacerbating issues that are there and widening some of those gaps. But over to you, Madhura.
There's also a question about which has come about raising revenues, and I think I'd like to address that as well. Is that in most developing countries, there has been a tendency for a reduction in the tax rate over the last 10, 20 years as part of neoliberal economic policy. You have tax havens globally. We have no wealth tax in India. So I think this whole phase of neoliberal economic policy, that's what I was saying, that we need to think about the pre-COVID consensus in large parts of the developing world, not so much in Europe, I think, has meant a reduction in revenues for the state. And the only way we can raise resources now is by increasing those tax rates and by taxing the wealth and those who are keeping their wealth outside the country. And I think this requires, I know I'm not an expert on this, but there have been discussions on global tax evasion. So this needs a global response. It also needs responses at the level of countries. I don't think that nationally and internationally we don't have the funds, but those funds are not in government coffers, and we need to get them there. And we see countries like Germany, we see European countries which have higher tax rates and better social security, coming out of this better. And to what needs to be done, I think, Glenn, we need to really expand not just the short-term cash transfers and food subsidies, but spending on education and health. And why you see Kerala today, in fact, other parts of the world are trying to learn lessons. You can't implement the lessons overnight. Kerala has invested in education and health of its people for the last 30, 40 years. And that's why they're able to come out of this better. So I think raising more revenues and investing in health and education for all, this is the next thing I would say, other than the cash and food, direct cash and food benefits. Thank you.
There is a question related to the targeting the transfer. So many developing countries have lack of mechanisms in terms of how you target people during crisis because they do not have any systematic transfer mechanisms in place. And also in this scenario, there are new poor who they are not under any safety net programs. So in terms of targeting this new poor versus the old poor, what are the ways that government in these countries can think about reaching to them?
I think that's a very difficult question because it depends on the systems in place. In a crisis, it's not so easy perhaps to put in a new system. In India, the states where you have decentralized local government, what we call panchayats, elected representatives functioning, there it is easier. There's someone with local accountability who can be asked to ensure distribution. I think in other countries, something that's been talked about is there are women's self-help groups. Again, this is something that is being in India. And we have seen that most of these women are concerned about their families and about their children. And dare I say, I think they would be less corrupt. So I think that we have to strengthen whatever existing institutions exist at the village level, at the level of an urban slum. It could be some kind of community or self-help group, or it could be an elected local representative. And we have to get those in place. I don't have a easy answer for how to deal with corruption and how to ensure better distribution.
David, you touched on this in your talk, but the idea that are you seeing countries kind of pulling in now and going back to some of those old policies of self-reliance and self-sufficiency? I mean, I'm hearing that rhetoric, not necessarily in terms of agriculture, but here in the United States, for example. Are you seeing more of that language across Asia and the Pacific, or are you seeing the sort of embracing the TPP approach of greater cooperation and trade? What is it, a mixed bag, or are you seeing any trends coming out of the COVID effect?
Yeah, good question, Glenn. I mean, it's hard to know, but kind of what I've been hearing is I've actually been surprised at how little talk there has been about going back to more self-sufficiency. I mean, you hear it out there a little bit, but much less than I would have thought. I mean, a lot of it too is, I mean, there's no, this virus is not being transmitted through international food supply chains. And there seems to be some understanding of that. So I mean, to me, that would be the, the main reason you would want to go to more of a self-sufficiency thing. So I haven't seen much of an increase. I mean, it's still there. There's a lot of talk like that, but I mean, that a lot of it's pre-COVID. I just don't think I've seen much of an increase compared to COVID.
Okay.
So there is a question related to the agricultural supply chain, which has been disrupted, and also the situation that the farmers are not getting the right price because in some cases there was no network in terms of the road and other connections. And in developing countries, we have seen that in some, especially the vegetables and others, are wasted. And a lot of farmers have lost their capital as well. So in this situation, so there is probably a role because the new seasons are coming up, and if there is not enough produce, then there might be a shortage in terms of the supply. And so there, even though there is a concern about the food security, but this might come up later stage if the farmers are not producing and not encouraged to produce more. And because the farmers also lost their income, so what sort of ways the government can actually deliver the subsidy or cash transfer to these farmers, particularly targeting the supply side of it?
You want me to answer, or who's?
Yeah.
So I think that in India, the experience we have is that the crop harvest, those who were going to harvest potato, these were the main harvest crops in April, May, they have not suffered as much in terms of they were able to harvest and they were able to sell their produce. But I think the real sufferers are, as you mentioned, as was mentioned earlier, many of those with perishable commodities, be it fruit, flowers. Culturists left the flowers on the field, they didn't harvest it. Industry destroyed poultry, eggs, fish spawn could not be developed. So I think for each in the rural economy, the agricultural sector, we need a special package of inputs, investments, not just cash transfers. You need credit to start the next season, but you also need to ensure that the feed is there, the poultry feed, that the fertilizer is there. So for each of these sectors, you need very specific interventions to get the supply chain going again, not just cash transfers.
So I think we need to wrap up now. So what I'd like to do, rather than try to summarize the complexity of everything that we've gone through in the last hour and a half, I'd just like to ask each of you, if you don't mind, just to give us 1 minute, just your final thoughts and sort of what you would like us to take away, what your main message is from this evening. I'd very much appreciate it. Maybe David, would you like to start?
Sure. Thanks, Glenn. I think, yeah, just briefly, I think it's going to be really important to expand social protection as much as we can, but thinking longer term, it's too bad we weren't better prepared for this, in advance, and we need to do what we can now. And obviously there's a lot of urgency, but I hope that urgency is not lost a year from now, when hopefully things will be a lot better with respect to COVID. But we want to make sure that we have these kind of flexible, resilient social protection systems in place so that we can deliver money through them when the next crisis hits, because another one will surely, of some sort, will surely hit. I mean, we've seen financial crises, now health crises. I mean, we get them all the time. natural disasters. So we really need to build up these systems and in advance, I would say. And then I think continue to, you know, foster a lot of collaboration between public and private sectors so that, you know, these supply chains keep functioning and are able to, you know, we're able to implement physical distancing, but also do it in a way that doesn't disrupt essential services like food and agriculture.
Marie.
Yes, I would recommend that we continue to think very carefully about where nutrition can be protected, and it's pretty much everywhere in the different sectors that we work in. And I say also, I think also that in countries where we work, especially the low-income countries, unfortunately, there cannot be a positive outcomes. It is a crisis that is there to stay, that I think we're all paying a lot of attention at the beginning, but life will continue and we will all move and go in our different directions. But I think the low-income countries are likely to suffer for a very long time, and we need to not forget to continue to try to protect them.
Thank you. Madhura.
I think that we need a massive increase in public support in a large number of countries, and this requires new resources. And I think we have to put some of these issues like taxation and the global evasion of taxes back on the table. The second is more, I think, something which was mentioned in the beginning by Marie, is how do we get at least some nutritious food to the most vulnerable, to women, to children, to the elderly. And I think if we can have a massive expansion of the cooked midday meal program in schools, which provides a meal not only to the children, but also to vulnerable persons in that community or in that village or in that location. I think at least some some improvements in the short run can be expected. Thank you.
Thank you. Thank you. Well, a lot of great ideas there, and perhaps the product of having 2 economists and 1 nutritionist and an agronomist, myself on the side. I think it really the analysis has been clear. There are many recommendations. I hope some people are listening. If not, we just have to keep voicing these ideas and moving them forward. And whether it's the next crisis or the second wave of this crisis, God forbid, there's plenty of work ahead for all of us. So let me just thank David, Marie, Madhura, for your contributions, and to the audience participants who've been with us this evening for me, very early in the morning for you, Madhura. Thanks so much, and I'm sure for many of the participants. So with that, I'll just pass it back to Asad to sign off for us.
Yes, thank you all very much on behalf of CDES and our partners, SIPA and MS Swaminathan Research Institute. We all thank you very much for joining us this morning or evening. We hope to see you all next week. We have our next webinar on Tuesday next week on cities in the times of COVID. With this, thank you all very much, and see you next week.